The lower back muscles work together with tendons and ligaments to allow for smooth and controlled movements between the upper body, pelvis, and legs. Tendons and ligaments are connective tissue that attach muscle to bone and bones to other bones. There are three main muscle groups in the lower back: the extensors, flexors, and oblique muscles. Let's take a closer look. The extensors lie at the back of the lumbar spine and form the bulk of the lower back muscles. This group mainly consists of the quadratus lumborum, erector spinae, and multifidus. The quadratus lumborum is a flat quadrangular-shaped muscle that extends upward from the iliac crest and iliolumbar ligament to the transverse processes of the first four lumbar vertebrae and the lower part of the 12th rib. The erector spinae lie vertically on either side of the spine and are further divided into the longissimus thoracis and iliocostalis lumborum. They extend from the transverse processes of the first four lumbar vertebrae to the iliac crest. The multifidus is a set of deep muscle bands that extends from the spinous process of a lumbar vertebra to the mammillary process of a vertebra 2 to 5 levels below. The extensor muscles help bend the spine backward. The flexors lie in the front of the lumbar spine. The main muscle in this group is the psoas major, a spindle-shaped muscle which extends from the transverse processes of vertebrae T12 to L4 to the upper part of the thigh bone. The flexor muscles help in bending the trunk and hip forward and arching the lower back. The oblique muscles lie on the side of the lumbar spine and include the internal oblique and external oblique. The internal oblique is a broad and thin muscle that extends upward from the iliac crest to the lower 3 ribs. The external oblique lies above the internal oblique and extends from the surfaces of the lower 8 ribs to the iliac crest. Together with the surrounding abdominal muscles, the obliques help bend the trunk forward. A combined effort from all the 3 muscle groups helps in more complex movements, such as bending and twisting in different directions. Strain to a lumbar muscle, also called a pulled muscle, can cause mild to severe pain and stiffness in the lower back. Most lumbar muscle strains feel better within a few days, but sometimes they can last much longer depending on the severity.